Our next panel is health concerns in esports, and I'm going to bring in our panelists and our moderator. So give me one moment here. If our panelists could raise their hands so that I can find you all, and there we go, I'm finding you all. Fantastic. All right, I am going to hand the hosting duties over to Kelly, who will then show up on camera, and then she can do the same for each of the next panelists.
All right, so make host. All right, I'm tossing it to Dr. Melita, so you can activate your camera as well.
Hi.
Hello. It's good to see you.
Thank you. You too.
And then can you pass that to Lindsey?
Pass it.
Just click on her name and it'll drop down.
Make host. No. No. I'm sorry.
No worries. No worries at all. Well, she just straight up disappeared on my screen. I think she said, nope, I'm out. So
she's an attendee now, so you'll have to go over to the attendee list, make her a panelist, promote her to panelist, and then bring her over.
Sorry, Lindsey.
And Melita, if you want to bring toss that back to Kelly and have her do that, it's fine.
Yeah, I don't have the option to promote. Make host.
There you go.
Okay, sorry.
Okay. So I passed it to Audie. And then once he's on, we can grab Lindsey. Zoom hot potato.
This is cool. I'm technically
Hey, I'm here.
Yay! All right. Back to me one more time, and I will grab Lindsey.
Okie dokie.
All right. Hold on, I'm coming. There you go. You should be panelist now. And I will throw you host.
Savage, Melita. Savage.
Hi.
Savage.
All right. So hello and welcome, everybody. I am so excited to be here. My name is Dr. Kelly Dunlap. I'm a clinical psychologist and I'm a game designer. And I am the community manager for Take This. Got my little pen, rocking that. And I am so excited to be talking about health concerns in this is something that's very near and dear to my heart as someone who was a competitive player in Halo 2. So very long time ago, long since retired, but very, very excited to be here and to talk with you amazing, wonderful guests. Do you guys want to take like 5 seconds and run down the line and just give a real brief intro to yourselves? Does that sound good? All right.
Yeah, shall I crack on? My name's Ati. I'm I'm a doctor in London, in the UK, and I work in psychiatry. I'm also a PhD student at King's College London as well. And I'm a member, or a committee member of a charity called Gaming the Mind, which is made up of mental health professionals with an interest in kind of promoting well-being amongst gaming communities and looking at the interactions between mental health and gaming as well.
If you don't follow Gaming the Mind on Twitter, you are missing out. I get like all the latest scoops from there, and my games list comes largely from there. So definitely check them out.
Watching our Twitter aficionado is watching this right now, so I'm sure he'll be very happy.
Yay! Snaps to them then. All right, Lindsey, I'm tossing it to you.
Hello, I am, before I get kicked out of the meeting again, my name is Lindsey Migliore. I am also a medical doctor in the field of physical medicine and rehabilitation. I am the founder of GamerDoc, which is an esports medicine kind of consultancy. We're working on, our next steps. I also am the president of Queer Women of Esports, a new nonprofit working towards advocating for the LGBTQIA population in competitive video gaming. I recently got hired as the advocacy director for Wiggy. I'm a Take This streaming ambassador and also a former competitive gamer, not Halo, but Call of Duty. So, yeah.
Maybe it was me that kicked you out. I don't know.
I know, it probably was. And I'm very happy to be here.
Thank you. All right, and saving the best for last.
Hi, everyone. I'm Dr. Melita Moore. Sorry, Lindsey, for kicking you out. Just as an FYI, I'm in the hospital, so if you hear loud announcements, that is just what's going on behind me. I'm a quadruple board certified sports medicine and esports medicine physician. I'm a team physician for a professional esports team that we just won the world championship last month for our NBA 2K league, so I'm excited about that. I also take care of traditional professional sports, and I'm a member of the board for the Global Esports Federation.
All right, so just a tiny bit of experience on this panel. But I want to get started kind of with a little warm up. What brought you guys to esports? Lindsey, you mentioned that you played Call of Duty. Did that translate into your medical training, practice, vision for yourself?
Sure. And Melita, we didn't mention that we have a book coming out next year on
Well,
esports.
I thought we were going to get to that.
Okay. Okay. Sorry. We wrote the book. So I have always been a gamer. I've been a gamer since I was 6 years old. Ocarina of Time and 64, best game ever. And I transitioned my way. I didn't even know multiplayer was a thing until high school, which was, being a smaller female, not yet knowing that she was queer gamer is probably a good thing. But I started playing competitively, and a couple things happened. I went to medical school and I was playing video games most nights. And, when you go to medical school, everyone wants to ask you all the questions about their health, even though you've only taken biochemistry and things like that. And so the people who I was playing video games with every night started asking me about like wrist pain they were having, or like tingling in their pinkies, or back pain. And, I tell them to go to their doctor and leave me alone. And they would come back and their doctor would say, well, we'll stop playing video games. Right. And when I finally, came on the other side of my medical training, I decided that was not an acceptable answer. And, I was going to find the answers to those questions.
So just a very intense follow-up that I think everybody wants to know. What is the weirdest thing to you? Is is this normal?
When they start unbuttoning their pants to show you something, that's when I'm out. So
I would have gaming related questions about that. Okay, good to know. All right, thanks. And so I want to check in with both Addie and Dr. Melita. I'm sorry, I was supposed to drop the doctors. I'm sorry. Addie and Melita. How did you two come to esports?
Yeah, so I didn't come to esports. Esports came to me. I didn't really know much about esports before 2 years ago. Where I work, we have a professional NBA 2K team, and they asked me they volunteered me to be the team physician for this new gaming team. I had no idea what a gamer could possibly need. I didn't really know about professional or competitive gaming. So thankfully, at the time, I was working with Lindsey, who has all of this knowledge and helped me get my knowledge base up very quickly. And so I did a very deep dive learning about gamers, what was out there for health and wellness, which was really not much. And then I just took it and ran with it. And so I'm glad to be an international thought leader in this space now. And I'm really a big advocate for health and wellness for gamers, and I really push education and awareness. So I didn't choose it, it chose me, but I'm so glad it did. I've done professional sports for a decade, and I am now shifting most of my, of what I'm gonna do in this medical space into more of the esports world.
Very cool, thank you. All right, Addie.
Oh yeah, and finally me, yes, happy. So I'm not actually involved in sports medicine or kind of esports medicine like my other two colleagues here. I'm kind of working in psychiatry, primarily looking at psychosis and things like that. So not really the standard things that you see within the kind of esports community and things like that. But I've always been a gamer. I mean, you know, we're doing the cliche, and it's true. And I guess my gaming history kind of starts back on SMB3 on the NES, so Super Mario Brothers. And then when I landed in high school, most of my friends were playing Warcraft 3, and that became my poison for a while. So that carried me straight into university, at which point I started picking up new games like Counter-Strike and League of Legends. So, you know, kind of competitive gaming has always been a big part of my life. And I always kind of, a little bit different to Lindsey, I guess. I always kind of compartmentalized aspects of my life. So gaming was after work or before work, and work was just work. So you know, keep little things separate. But when I went and joined the team that I'm currently working with at the moment in London, I met a group of doctors who had set up the charity Gaming the Mind. And obviously they, initially I just joined to kind of have a place to talk about video games and kind of anime and manga and just kind of general gaming culture stuff. But then it kind of gave me a bit of time to reflect on kind of my own well-being in gaming and my own kind of habits and stuff like that, but through looking at the work they were doing and kind of applying that lens on my own life. And I kind of realized I had unhealthy practices 100% with my own kind of behavior and things like that. And kind of going forward, it made me kind of want to be more aware of what's actually going on in the industry. And also, I guess, more importantly for me, it's kind of understanding how that kind of behavior or kind of practices trickle down into gaming communities. So the actual people on the other side of that screen watching these games. So yeah, that's kind of how I kind of fell into it, really, yeah.
Wonderful. Again, I'm so glad that you all are here. And as always, if there's any questions in the chat, feel free to throw them in there. I keep an eye on it. Or there is a Q&A button, and we can store them for later too. So if you hear something that sparks your interest, feel free to jump right in. And so now we kind of got the intros, we're warmed up. I want to dig into some of your specialties here. So specifically for Melita and Lindsey, you both work with pro athletes, both the smashy head type and like football or like physical, I don't ever like see it in real life because that has a very derogatory sense to it. But you work with athletes who work with very physicality, and then you also work with esports athletes where there is also physicality but is less head smashy, I guess. What differences do you guys see between the challenges and some of the struggles that they go through in terms of their health, their physicality, things like that?
Well, so I call it traditional sports and any sports. Head smashing will certainly take that too. So there are, it's interesting. There are a lot of similarities, but also a lot of differences. With our traditional athletes, when we talk about health and wellness, they've grown up in this space. If you are talking about a professional basketball player, they've done their AAU league here in the US, or, their development league as a child, and then they played high school sports, and that's when they started getting with nutritionists and strength coaches, and then you got to college, and so they have everyone at their fingertips helping them, making sure that they're maintaining their tip-top shape so they can go out and perform. So in our traditional sports landscape, that's what everyone's used to, and especially when you get to the professional level, if you blink an eye and there's someone not there at the drop of a dime to say, hey, my knee hurts, or what kind of smoothie should I have today, or what kind of exercise can I do? That's what we expect in traditional sports. That is what I see the biggest difference with our esports athletes. And I know saying esports athletes is very controversial in the gaming space, but for me, I'm an esports medicine physician, so they are athletes to me, and I think when you give them that title, it gives them a different level of respect. But they haven't grown up in these development leagues, and they don't know what they don't know. And I say that all the time. They don't know that there are foods that they can eat and exercise they should be doing and why sleep is important. They just get out and play. And so that's where there's the biggest disparity. And I think the educational gap for gamers versus traditional athletes. And so that's one thing that I really try to push is the importance of, mental health, vision, sleep, exercise, hydration, nutrition, stress management. So that's a big part. Some of the similarities, I think, is the intensity. So when, there are a few studies that are out there where you're talking about a heart rate of a gamer when they're in the middle of, when they're playing versus when they're practicing, and that gets up to the same level as traditional sports. And you may not be moving all around, but your heart rate is certainly getting up. You're intense, you're in the zone, you have a lot of cognitive or mental energy that's going on. Your fingers and wrists are moving, depending if you're on a console or a PC. So that is the physicality part, but all those little small micro movements, they add up. And so it is rigorous. It's rigorous for esports and it's rigorous for traditional athletes.
Yeah, I couldn't agree more with what Melita, all of your points, but specifically your first point, that lack of growing up in a team environment with resources. When you finally are given those resources, you have no idea how to use them. It doesn't matter if you have a gym in your beautiful esports facility, if no one knows how to use the equipment and if people are afraid of using the equipment. I think another huge difference is for college and even some high school programs and definitely professional programs, you have a head athletic trainer. And the head athletic trainer has a medical background, and they have extreme knowledge of the sport, and they've been training and in this field specifically in that role for many, many, many years. And they're really the quarterback of the care. The sports medicine physician isn't in charge of the health of the team. The athletic trainer is, and they only call in the sports medicine physician when they need them. And so having that athletic trainer coordinating the nutrition piece, the training piece, they're the ones who are talking to the coach. They're the ones who are talking to everyone. That their knowledge they impart on their teams. But in esports, the person taking on that role is really the coach. And the coach is just a retired player, right? A player who retired at the old age of 23. So they don't have that medical background. They don't have that training. So while they may be better than an athletic trainer in terms of gameplay and skills, they don't have that knowledge of how to use those resources either. So that's one of the reasons why, coaching clinics and coaching training is so important in the infancy of esports medicine because of that lack of knowledge and background.
All right. And then I also want to shift a little bit to Addie and ask, so in terms of the non-competitive esports players that you work with and you write for, as well as those who are aspiring to that level, are you seeing similar things where, once they get to the resources or have them to start with, at least from a health perspective?
Yeah, so I guess, first of all, I completely agree with everything that Melita and Lindsey mentioned about the kind of infrastructure in terms of healthcare for traditional sports in this. And I think, but and they've already marked out the difference that exists in the States in terms of high school, varsity, collegiate kind of sports differences. But over on this side of the pond, we don't really even have that infrastructure either, right? So we just have amateurs that go to kind of local tournaments, or they become big on streaming, and that's how they kind of develop their presence and things like that. So, for the work that I did for the British Esports Association, just kind of the feedback I got from that was just they hear it kind of through white noise. So it's just things that are kind of barked at them, which I completely empathize with, because everyone and their mum knows, sleep better, eat better. But a lot of these people, the people that we aspire to work with and the esports athletes, they are, they're young. They are far younger than the image of the athlete that we see on the television, according to, sports that we've kind of just been associated with. So I think they need a little bit more of that helping hand. And the way to do that, especially, I think, so through some of the events that I've attended over here in the UK, so, through parliamentary projects and groups and things like that, it became very clear that we are starting to build some level of an infrastructure here. But I think there needs to be a push towards well-being in terms of these athletes, because we know from experience from the kind of professional teams that these injuries not only occur, but they're concerningly common. I'm not just talking about physical, I'm talking about mental and trauma and exhaustion and things like that, which I'm sure we'll come into at some point, one of the hot topics. But we know that it exists. So if we are designing systems to facilitate kind of esports industry, in other places other than, from America and across the world as well, we really do need to have a foothold in helping these people early, so that we don't see this kind of high drop-off rate later on down in their career.
I think Lindsey actually had a tweet not that long ago about there's no reason that someone should be considered a grizzled ancient when they're 23 if they're playing a Twitch shooter, and that is, there's a lot of reasons for that, but there's no physical reason necessarily. And I think that's a very interesting point that Ade brings up, is the age of these athletes is maybe more in line with something you would see with maybe an Olympic gymnast. And so what are the differences, both physically and mentally, in working with people who are at a younger age than maybe you would expect for a professional college athlete or a professional college athlete? I'm sorry, that is an oxymoron. A college athlete or a professional athlete.
Well, I think with esports, for sure, when we're looking at our professional gamers or professional esports athletes, the age around retirement, and Lindsey, you can correct me if I'm wrong, is around 22 to 24, I think is their average age of retirement, which is insane because, number one, there's so much life left. And if this is your career, obviously we all know that there's so much more to do in the esports industry outside of just being a gamer. But if this is really your passion and you're saying at 22 to 24, I'm out of here. Our traditional athletes, they're just graduating from college. They're just now getting into their professional career. And so I certainly think it goes back to this development. If you would have known sooner, which I'm glad we're having this panel because now people will know sooner. It's just because esports is a younger, not young, but a younger industry and is more recently become mainstream where parents actually know about it. And it's not just, the people grinding out that know about esports. Hopefully we see this shift to where we're going to see people are going to be gaming much longer. Their careers are going to be extended because they are doing the proper training, the hydration, the nutrition, all these other things that you need to do to really enhance your performance, prevent injury earlier on. So when we are talking about these younger gamers, middle school, high school, 12, 14, your brain is still developing. And I'm certainly not going to take this answer. That's for Ade. He's a psychiatrist. But we know, at 16, that's a pivotal age. 21 is a pivotal age for brain health and cognitive health. So there's a lot more memory, a lot more space and things that are going on in these younger people's minds. So that's just interesting. I'm hoping that we're going to extend the lifetime of a professional gamer.
And at this point, I'd like to say that esports orgs are going to be get on that health and fitness train and get really excited about it just for the health of their athletes. But there is a huge performance aspect to it that we are missing. Don't quote me, it could be 1 or 2 years off, but I think the average age of a Pro League of Legends player is 21. The average age of a CSGO player, I think, is 23. In comparison to the average age of an NHL player is 26, and a Major League Baseball player is 29. You got people like Tom Brady who's playing in his 40s, Brett Favre. We're seeing, Le'Veon Bell. Adrian Peterson. I could go on. Ovechkin. We're seeing these greats of their sports playing well past their prime. And it's because, Tom Brady's not in his peak physical prime anymore, but his knowledge of the game is unparalleled. His teamwork, his leadership skills, his ability to read defenses, those are unparalleled. And I can only imagine how many Tom Brady's of League we've missed, how many CSGO best ever has been missed because they got burnt out at 22 and weren't given the correct resources, or they had a cubital tunnel syndrome that was 100% treatable in the beginning because they had the wrong armrest height, and then they lost function in their hands because they didn't get it treated for 4 years. So I think that, yes, we want people to care about the health and the wellness of these athletes, but you're going to see a higher level of play if you invest in these initiatives, and you're going to see more returns on your investments. You're going to see less player turnover, more player retention, more player satisfaction. So, these are all just really important components that hopefully will be fixed in the future.
Addie, did you want to add to
Yeah,
that?
absolutely. And I think what's kind of particularly interesting in terms of the kind of expansion of kind of promoting well-being and caring for these athletes is that and, as clinicians, we all know that we try our best to kind of to ensure that we practice evidence-based medicine amongst kind of all of this, and that's true with traditional sports or esports or wherever you look into, whatever field you want to look into, and with that kind of outset or kind of mindset going forward, it's important to kind of think of the considerations and the differences between esports and traditional sports. I mean, even in traditional sports, which, society and culture and, of course, science and medicine has been able to grow at a relatively similar pace. So they've kind of grown with each other. Even in that kind of situation, we have still scientific discoveries that need to be made and have been made only very, very recently, which have helped us kind of guide advice to these athletes in traditional sports. So I guess the best one for most of our viewers who are likely American or in North America is the kind of concussion gate that happened with American football, where they found that chronic traumatic encephalopathy was associated with current kind of concussions and head injuries throughout many years, and that these were post-mortems that were done on athletes. And even though it was something that perhaps we would have made an educated guess that was the case, it's hard to implement change or implement policy without the necessary evidence in place. So if we think of that, and then we think about, as Melita mentioned as well, this is not a brand new kind of industry, the esports industry, but it is still in its early days compared to these other kind of traditional sports that are in place. We are able to extract some levels of data and information through, so for example, some of the injuries that have already been mentioned, like wrist injuries or finger injuries or elbow injuries and things like that, those kind of things. But there are areas that we still don't have good enough information for at the moment. And I think Leo touched upon this in the chat earlier, where there is a gap in knowledge that desperately needs to be filled, essentially. And there was a really interesting paper that came out this year, actually, where they kind of discussed some of the kind of key points that they find interesting, where these gaps kind of exist. It was published in the Journal of Sport and Health Sciences. And the top three that kind of stood out for me was the impact of physical inactivity, sitting for a prolonged period of time during digital play, and the ramifications of that, over long term, because we know how it can affect you reasonably well in short term, but what we're looking at in terms of lifelong careers, if longevity for our athletes is what we're interested in. In terms of the training regimes and playing in that, so what are the acute and chronic kind of health risks associated with that? And I think, so we were just talking about league, and obviously I'm a big fan of league. I mean, I must admit I can't keep up with everything these days, but the last big thing I watched was probably the Worlds last year. But Uzi, who was a fantastic bot laner, just this year pushed himself to retirement, and actually a quite sad series of tweets, discussing, he was 23 and he had diabetes, and he was concerned about his obesity, and he had a wrist injury. He's 23 years old. I mean, when you see, as clinicians, I'm sure, when you see your traditional mind image of someone who has diabetes, it's not a 23-year-old. It's not the image. So that, and then finally, obviously, the thing that's most interesting to me is the kind of psychosocial and cognitive effects of esports competition. So Melita already touched on it. We've been talking about the kind of stress levels that these players go through and how that affects their cognitive decision making. And in fact, the heart rate does actually go up ridiculously high. It goes as high. The one study that came out of the German group said it went up to the same levels as F1 players, F1 drivers. So you can imagine going, over 120 miles an hour on a circuit, and try and imagine that same heart rate when you're sitting still, tapping on a keyboard and a mouse or playing on a controller. So yeah, there are certainly these gaps in knowledge that I think will help us as clinicians give the appropriate advice, and not just in terms of optimizing their performance, but actually giving them the quality of life and health that they need going forward as well.
And if you want to, go ahead.
That point was, it was just very poignant, and especially bringing kind of concussion in just kind of as the example. So I'm a brain injury specialist. Concussion has been my life for the past 10 years. And how I treat a concussion now versus what I did 8 years ago, it's very different. And it's because we now know more. We know about CTE. We've changed our protocols. I've done national policy on concussion, but then it had to go back to this whole cycle of education, and why we had to educate the athletes now, and the coaches, and now the parents. And so to have that kind of information, I mean, obviously this is a panel of clinicians, so you're speaking our language, but that is exactly where esports has the opportunity to kind of course correct early before we get to that point. And so having researchers like yourself and Lindsey and I have done some research projects and looking at all of this data that's now coming out on esports and research, that's going to help us create policy and change the culture, change the habits, and it all comes back down to education, I think. So that was just a very poignant point, that's something that's certainly needed. And I think we are off to a slow yet good start from that perspective.
Yeah, I just wanted to say, I feel like that I may have projected a little bit of doom and gloom there. That
No, not at all.
I do really want to say, like, if I'm sure you've included this in your book, that in the past 5 years, there's been an incredible rise in PubMed, so the kind of public research repository where we find all our evidence for medicine. I mean, in the last 5 years, there's been great improvements in the number of papers and things that are available. But obviously,
no doom and gloom, only science. Which,
yes, exactly. Yeah.
Depending on the day. And so I want to pivot a little bit because I have questions, and I thought of about 30 more, and I realized we only have about like 20 more minutes. So I'm going to do a hard shift here. We're all clinicians here. It's a very Hippocratic oath kind of crowd. And the cynic in me is hearing like, yes, we want our players to have the longest life and the best resources. We want Walshy to be playing Halo into his 40s. He might be 40 now, actually. But anyway, like we want these players to be able to stick around and return on investment, blah, 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 blah. Because like we care about them. We're physicians, we're mental health professionals. We want people to do well and be well. However, that's not all the case in sports in general. That's also not the case in games in general. And I'm wondering, like, when you're talking to other organizations about, hey, it's worth this investment to make sure your players are educated and that they are healthy and they have access to these resources. I guess the crass way of saying it is, do these organizations want their players to be healthy? Is it more like a GameStop model where there's always someone right behind you and we'll just kick you out the door as soon as you're too old for it? Or have you seen actual examples of organizations doing something well, like kind of a poster child for either a game developer or someone in the game development space to go, this is how you do it responsibly. This is how you take care of the people you are responsible for. And this is why you should do it, not just from a, touchy-feely, we want everyone to be healthy thing, which is important, but also like financial. So something that, we kind of have to loop in. And maybe Lindsey, you can speak to that as the founder of Queer Women of Esports. Like, I imagine you're knee deep in that right now.
Yeah, and I've also been doing a lot of private consulting for esports orgs recently. So I'm living that NDA life, so I can't talk about a lot of it. But two orgs that I don't work with, but are doing a really good job. One of them is CounterLogic Gaming, CLG. They have a head of player development. Her name's Summer Scott. She is brilliant. She has a psychology background. She got her BA in psychology. And she worked as a performance coach prior to this. And she is basically in charge of, all of these things that we're talking about. And she's working very hard to keep the players healthy. CLG has also involved 1HP in the past, which is a physical therapy brand for esports. So CLG is seeing the investments. I also think Complexity Gaming, they are working in the same performance center as the Dallas Cowboys. They have the same access to the trainers and to the therapists and things like that as the Dallas Cowboys. There's good and bad ways to do it. I think a lot of times well-funded orgs who want to get involved in health and wellness tend to throw a lot of money at things. And if you don't have properly trained professionals, that can be good and it can be bad. Like, so if I'm speculating here, but if Complexity were to use the same protocols that they're using with the Dallas Cowboys for their esports athletes, that could be potentially harmful, right? And unfortunately, right now, there isn't a protocol, there isn't a set of guidelines to treat esports athletes. And that's one of the things that Melita and I are working on, is creating those guidelines. So when people do want to throw a bunch of money at a project, they can say, okay, this is how we do it. I know a couple orgs are moving that I am working with, are moving towards health and wellness initiatives in the distant future. The only problem is that while esports continues to grow, there is a focus on budget cutting right now in the industry. We see in the Call of Duty League moving towards a 4-player format, not expanding. We see a lot of roster cuts and budget cuts, especially in the Overwatch League right now. And that's largely because people who were interested in the business side and not necessarily having any knowledge of the esports side threw a bunch of money at it and expected an immediate return, which is, it's when you buy a team, if you buy the Dallas Cowboys, they're not going to give you millions and millions of dollars every year. It's a long-term investment. That's another aside. But so right now we're seeing kind of a constriction. But I think when we rebound from that and esports kind of takes its more natural path, there's going to be a bigger focus on health and wellness. But yeah, CLG and Complexity.
And it's interesting, even in traditional sports, not everyone is focused on the athletes, and that's the product that's on the floor, on the field, behind the screen. I just, left a WNBA bubble, Women's National Basketball Association, professional basketball, and the lack of resources that were available in this professional bubble, some people would find very interesting. And we're talking about, this is a professional league, they have their own ESPN. And so you really have to take it back to, what is this all about? If you don't have a product, you don't get money, you don't win, you don't have success. And so I think in the esports space, this also holds true much more than it does in traditional sports. And, you have a $50 million buyout to get a team, but yet you're not doing anything. There's no sports and performance. There's not a exercise physiologist. There's no nutritionist. There's not a physician to then take care of these athletes. So that is where I think there's a huge problem. And again, another opportunity. It's interesting with some of these professional teams where you have retired professional athletes that have bought in. They're doing things a little bit differently because they know, but I think overall there's a lot of growth that needs to happen. I was speaking with the team that was traveling for a competition, and they're talking about, that's a bubble type of situation. Well, how are we preparing our athletes? There was nothing. And so I certainly think that, especially if we are going to be living in these COVID times for a little while, and if we are going to have these international competitions where people are traveling and there may be a bubble set up, these are the now. I know, Lindsey, you were saying a distant future. This is the right now, and even educating on what you need to prepare your athletes for that type of environment, what kind of services you need to have, what kind of specialists need to be there. So this is a big growth opportunity for owners of teams, leagues, to really get it right.
Yeah. So just to kind of go back to what Kelly mentioned, actually, it was really interesting when in terms of the thinking of the kind of esports teams and the industry as a whole. And I think, just touching on the kind of some of the pressures that some of the players are experiencing, and one of them that Kelly mentioned, which is obviously really, really important, is there this backlog of, many very skilled players that are in the kind of amateur leagues or climbing up during through the smaller professional leagues. And it's probably a lot more likely that the bigger teams will be able to have the facilities in order to promote a certain level of healthy lifestyle, or, as Lindsey already mentioned, hire the necessary specialists that come with the knowledge to help these athletes. And I think has become a lot more interesting to me over just recently, really, is these players that are kind of waiting in line for their turn, and whether or not they have the same opportunities or the same level of access, or just mentioning that these teams are having cuts, and so thinking the knock-on effects that it will have for these teams waiting in line as well, and these athletes waiting behind. and then taking that one step further again and thinking about how gaming has probably become the most accessible form of kind of sports available at the moment during COVID times. And even before COVID, you know, it takes, if I was to play, I'm going against my British instincts and I'm going to say soccer. If I was to play soccer here, yeah, I'm going to need myself and a group of 9 mates who are free at any one time to go play five-a-side. We need field, we need kits, you know, and you know, we don't, in terms of gamers around the world, gaming is truly global. Whilst things like soccer are more high concentrations in different areas and things like that, but you know, in some places you need kits. In gaming, you know, esports is on a phone. I can pick up my phone and play ranked games in Arena of Valor right now. I can be anywhere. So the behaviors and the attitudes that they see from the top teams that are represented now. So they see these players, you know, retiring at 23 because they're training, you know, incredibly hard and they're working incredibly hard. And another thing is that they're traveling incredibly all over the world. And part of the main reason I mentioned earlier was the reason why I've stopped watching so much League of Legends is that I'm getting tired of keeping up with all the teams and the rotas and who's winning and who's top of the league. So you see that level of fierce competition that people experience in the highest level of the game. So it may not necessarily be right, but you can understand why these younger players or aspiring players are putting themselves on the grind day in, day out, and picking up these unhealthy practices because they simply don't have access to healthcare the same way that everyone does, and picking up these bad habits that if, and hopefully when one day they do become professional players, they bring with them these kind of bad habits and basically a frame of mind that has already set in, which is unfortunate, which is something that I hope, you know, the industry as a whole, we're moving towards something that is more sustainable for people coming up as well.
Absolutely. And I want to be mindful of time because we have a couple of questions in the queue that I definitely want to get to. And one of them just really dovetails exactly with what we were just talking about. I'll throw this one out to anyone who wants to field it. This is from someone named Raphael Sorry, that's Dr. B. I'm using, I love you, Raf. He is the clinical director for Take This, and he's kind of my boss. So, yeah. What Dr. B said is, given the international nature of esports, what kind of international diversity do we see at the collegiate level, and how does that cultural diversity affect the players?
Well, that's an interesting question. And I am doing a lot of global work, and it's interesting at the collegiate level, it's not the same. And that's when we kind of get into the inequities of esports and, you know, the lack of Wi-Fi and the lack of this digital divide that then also creates this divide when you're talking about college and potentially getting a collegiate scholarship. So I think in the US, which I think probably, and people may raise their hand if I'm wrong, but I think that the US has a good system that we are setting up in place from high school to college with regard to scholarships and creating these collegiate teams. I know over in the UK, you know, the British Esports Association, you know, under the leadership of Chester King, they're just doing some amazing things when it comes to education. And I certainly think that they are an example of role modeling for what they're doing. And that's coming from the young kid up through collegiate. So we're just talking about your casual gamer to maybe an amateur gamer. So when you talk about the education perspective, trying to get some protocols together, trying to have some initiatives, I take my hat off to the British Esports Association.
Wonderful. All right, I'm going to move on to the next question, unless someone has a burning desire to add on to that one, because it was a great question. Thank you. And so Eve, my other boss, asked, oh my goodness, let me move this out of the way. How does moral panic around games lack of knowledge? So earlier we were talking about there's just a lack of knowledge around, you know, having nutrition and exercise, and the fact that maybe I'm sitting there and maybe my wrists hurt because I'm trying to claw instead of, you know, buffer. So how does moral panic around games as them being bad, evil, etc., do you think, how does that play into that lack of knowledge?
I think it's huge. I think it's a huge play in. People who could be benefiting the industry probably are sitting on the outside because of that misconception. there's still I can only imagine how many people still think that video games cause violence. And I think there is also a consideration when you're looking at the titles that you're playing. I know it's not entirely moral panic, but CSGO, the entire basis of the game is a terrorist trying to plant a bomb. And so brands tend to not, brands who may not sponsor CSGO have been looking into titles like Valorant and things like that, because it tends to be more family friendly and less controversial. So I do think it probably is preventing a lot of intelligent people, a lot of brands, and a lot of benefits that can happen to the industry because of that misconception. And I think that things like this, where we're 4 doctors talking about video games all day, like that in and of itself is helping change the narrative. Melita was at a talk I gave last year at a medical conference, and it was a room full of hundreds of physicians, and my whole talk was on video games. And the look on these old dudes' faces when I said what I do, it was amazing. But the next time they hear that, they're going to have less of a misconception. And I know when you ask a medical doctor, a psychologist question, you're going to get something that you don't want. So I'm sorry, Eva.
Whoa. What about that did I not want? Do we need to process this? Do you want to talk about why you're feeling this way?
There's a psychologist answer.
I'm sure I don't know what you mean.
That it's a barrier to parents. It's a barrier to parents to allow their kids to play, and certainly to play certain titles. So I think it not only is it a barrier to brands and to other people, for other people wanting to get in, but parents, and when we were talking about this younger gamer, they hold the control, supposedly. I mean, it's their money that has to buy these games and things. So I just think that it creates a barrier to the parents, allowing their kids to actually get involved and really take over and understand the true benefits of gaming and all the positive benefits that it has with socialization and cognition and positive vibes. So,
and I'm wondering, Addie, if you've had a similar experience from like the mental health perspective of working parents a lot, who kids are really into games and especially into esports, and trying to explain to them that this is not inherently like a terrible thing for their kid. Like I was working with someone, and they were a StarCraft grandmaster. Like, holy cow, I know what that means. It's amazing. If you talk to their parents, there's like, yeah, he just spends a lot of time playing video games. Like, you don't understand. It's like the equivalent of a chess grandmaster. You don't get it. And so, yeah, Addie, do you see that kind of thing too on the other side of the pond?
Yeah, so I guess, so the kind of patient group that I work with is predominantly adults. So I have very little kind of face-to-face time with, parents and their children in a clinical setting. But, as we all know, because it's the reason why we're here, geek culture transcends age groups. So the thing that I found that has helped me massively clinically actually is finding time, exploring some of these kind of patients' hobbies and things like that, and finding that, yeah, I'm a huge comic book nerd. Yeah, I'm massively into esports. Yeah, I'm massively into, Star Trek and Star Wars and all that stuff. Let's talk about it. So for those people, I think those aren't things that necessarily they'd give up on first contact with their clinicians, because obviously, despite geek culture being the zeitgeist now and everyone needing to catch up, it still has this stigma associated with it. So obviously this is anecdotal, but if you take that same framework and assume that people are coming at video games and coming at this whole kind of wider gaming culture with that stigma, then you can completely understand how, let's say, younger players who have had their first injury, and they've not, they're not part of a professional team yet, they've got their first injury, let's say they've got carpal tunnel syndrome. They just think, I'll play through it, because they don't understand the significance of it. And also, they don't want to go and tell their doctor, I got this. How did you get this injury? Because that's what every doctor will say. How do you think you got this? I play, 4 hours a day on my mouse, and I sit in a very bad posture, and I've clearly, done something to my wrist. I don't like it. It's an uncomfortable conversation to have. But I think this is why things are getting really interesting now in esports as a whole, which is this idea that as we see more and more of these, grandmaster players, which is literally what they are. They're phenomenal players. As we see them retiring primarily due to injury, rather than this idea that they've fallen off skill-wise or something like that, because clearly these are very, very skilled players still. It shines a light on something, and hopefully, as Lindsey was mentioning, shining lights on things, it eliminates stigma slowly, sure, but as esports is becoming basically ubiquitous now, it's all over the place. The more and more people are aware of these players that they're interested in, and the more and more, stories of injuries and health concerns and things like that, we can see that these players will hopefully start developing an attitude in their mind that if I'm going to really go for this, or if even as a hobby, if I'm going to play this as a hobby, clearly I need to take some steps to make sure that I'm not, going to struggle with consequences of certain behaviors when I'm in my 30s, which to these guys is obviously grandfather age, not how old I am. Yeah. So
what you're saying is my diet of Hot Pockets Cheetos is not a sustainable thing. And I do not say that as a stereotype. I say that is what I ate, played Halo 12 hours a night.
Yeah,
So
do you do healthily.
Okay. All right. We have one more question for you. If you have others, feel free to throw them in, and then we'll see if we can get there. This is from an anonymity. They say, have you ever had an experience of the game developer or publisher establishing the rules or requirements related to the athlete's health, physical or mental, for esports organizations participating in their leagues or having partnership relationships with them? That's a lot of words. So if I were to summarize it, do you have any experience with game devs who basically have some kind of like quality of life requirement for partnering with an esports organization using their game?
I have not come across any.
So Overwatch League in their inaugural season, they had a set of principles. It wasn't guidelines and it wasn't regulation. It was principles, and they were a bit vague. But everyone thought at the time that it was a great step forward. But I think it's a bit difficult when it comes to esports because it's not traditional sports. There isn't an owner of all American football. There isn't an owner of all soccer. These developers, they have ownership of the game. They have ownership of the rights. They can change the game at any time. So in all intents and purposes, it's basically some form of monopoly. It can be considered as such because they have all intellectual property in all its regards, which is why the idea of player associations becomes so much more important, because you can make a grassroots movement with the players who understand each other, who share their stories and anecdotes of things that they're struggling with, and they can develop their own set of principles that they can take forward and help organize collective bargaining in some regard. And the best example for that is in Counter-Strike, where they have their own player association, it's called the CPAA or something. I can't remember the exact name of it, but it's a group of 100+ players across the world. And they've developed this organization, their own guiding principles that says they will not go from one tournament to another without a reasonable break time, a reasonable grace period for themselves to recover. So even though there have been attempts from the developers' angle, we've seen movements in the right direction is the optimistic way of putting it from the developers' side to kind of put down regulations to help their players. It's an honourable gesture, but I think due to the framework of how developers own the title and own the intellectual property and essentially own the tournaments for some of the bigger games as well, what we're seeing is perhaps a bigger movement from the bottom up. So for players getting some level of ownership and talking about each other and their own well-being and the needs that they have and bringing it up through that regard.
It's almost like the inequalities and workers' rights issues that are prevalent in traditional sports are also prevalent in esports.
Fascinating, right?
So we are just about out of time, but I do have one very selfish question. This was a very heated debate on one of Lindsey's streams. Was the pronunciation of the word nootropics or neurotropics? Because that's a question I wanted to ask, but I don't think we have a ton of time to get into it unless Lindsey wants to do like a lightning round on the use of So first of all, neurotropics, what is it? Supplements?
Supplements. Go with the aren't supplements. I go with nootropics.
Okay. And Lindsay, did you land on one?
So a good rule of thumb is never make fun of someone for pronouncing a word wrong, because that means they learned it by reading. And I say nootropics.
Nootropics. Okay.
We all know what it means.
I'm never gonna disagree with Dr. Moore, because she's
Not
trained
true.
me. So no.
Oh, Addie, do you want to weigh in? This is a very important question to end on.
So I mean, I guess I could probably get away with having a different pronunciation anyway, because I'm over here and I have a different accent.
And cephalopathy. I mean, come on.
Yeah, exactly. It's edgy, right? It's a bit trendy. But I mean, I would say nootropics. I would say nootropics. Yeah.
Okay. Yeah, I say it differently. Okay.
I guess
I just wanted to,
Yeah.
I now have.
Yeah.
1 out of 3 doctors says this word the same way. But yeah, we have 2 minutes. So anybody want to try and do a tweet length, just any kind of feedback about tips and the closeness between a lot of esports teams and a lot of companies that are promoting nootropic supplements increase like gamer edge and gamer advantage and reaction time.
Kelly, how
I
I feel about this. I think that
do.
esports organizations, because their viewership skews very young, they have a unique responsibility to be a little bit more ethical in the products that they promote. I think that untested and unregulated substances pushed by large pharmaceutical companies that are for profit and have no oversight is abuse. And I think it is something that companies will be on the wrong side of history for. I think that pushing drugs to a pediatric population to make you better at video gaming is borderline criminal. And I think, yeah, that's what I think.
I certainly do not endorse them, but there's also there are medications too that are considered. I mean, Adderall, Ritalin, Provigil. These are drugs of abuse in the esports industry, in our younger gamers even. So that falls under that nootropic. It's not just supplements, but it's also prescription medication that's being abused for other things than what it was prescribed for. So on the supplement side, I agree with Lindsay.
Yeah, and what Melita was bringing up too is, there are other drugs of abuse, but because of FDA regulations and because of rulings in the late 90s, we know exactly what's in Adderall, right? We know what is in Adderall. It says it's in Adderall. You have no idea what's in supplements, right? They are not tested. They're not verified by third parties. So they could say that all you're getting is keratin for your eyes, but it could be anything. It could be anything.
All right. Well, so for any game devs out there or execs who are considering wanting to get more involved in esports and are concerned about the health and welfare of the people playing their games in esport, just, a hot take here, maybe think about the partnerships you might make if you are looking into supplements or nootropics or neurotropics, whatever the case may be. And that is exactly 3:30 Eastern time, 12:30 Pacific. And so I'm going to hand it back over to Eve. And while she hops in here, thank you panelists so much. I literally need like another 10 hours because I have so many questions. So thank you so much for being here.
Thanks, Dr. Dunlap.
Thank you very much. It was lovely meeting you. Take care.
Bye.
Thank you, Kelly, and thank you, Melita and Ati and Lindsay. That was a fantastic panel. I am now going to release you all for a break. I hope you all have a chance to eat, to get up and stretch your legs. We will regroup in 29 minutes. And I encourage you all to, in the meantime, check in with chat and take a break. Thank you all so much.